Hello everyone, in this class we'll learn about how to examine cranial nerves 7 and 8, that is facial nerve and vestibulocochlear nerve. The facial nerve is mixed nerve. It has both sensory and motor component. The sensory, it carries the sensation of taste from the anterior 2/3 of tongue and also supplies the muscles of facial expression as a motor component. The examination of the nerve includes testing for the four primary tastes like sweet, salt, bitter and sour, and the muscles which are involved in the facial expression. The requirements are the four test tubes containing solutions of sugar, common salt, lime juice, quinine for sweet, salt, sour and bitter separately. Then the procedure is, for the sensory function, ask the subject to not to speak while examining and ask the subject to close the eyes and protrude the tongue. With a glass rod, place small quantities of test solution on each side of the tongue. And ask the subject to open the eyes and identify the taste by pointing the appropriate card. And ask the subject to rinse her mouth after each test. Apply quinine as last, as its effect lasts longer than that of others. For the motor function, to examine the facial expression, observe and compare the facial expression and mobility on both the sides. Ask the subject to frown or raise the eyebrows and observe the wrinkles on the forehead to test the frontal belly of occipitofrontalis. And then ask him to close his eyes as tightly as possible and try to open the eyes with your fingers. This is to test the Orbicularis Oculi. Then ask him to inflate his mouth with the air and blow out of the cheeks. Tap each inflated cheek with a finger to test the power, and so this will be testing the buccinator muscle. Ask him to whistle. This test will be for both buccinator and orbicularis oris, and to ask him to show his teeth. Okay, so that is going to test the orbicularis oris. And ask him to clench his teeth, where you can see the folds of the platysma in the anterior part of the neck. Facial palsy. Lesion in the facial nerve leading to paralysis of muscles and may not be associated with sensory loss. There are two types of facial palsy depending on the site of the lesion: supranuclear palsy and infranuclear palsy. In supranuclear palsy, there is a paralysis of muscles in the lower half of the face with normal wrinkling over the forehead. Whereas in infranuclear palsy, there is a paralysis of one half of the face resulting in an expressionless faces on that side, wide palpable fissure, obliteration of the nasolabial fold, and drooped angle of the mouth. The lesion at the level of stylomastoid foramen and beyond results in a classical facial nerve palsy or lower motor neuron palsy, that is called as Bell's palsy. Okay, so this is the Bell's palsy, where there is a lesion, there is a paralysis of the left side of the face, okay, where you can see the drooping of the eyelid, the loss of nasolabial fold, and the drooping of the mouth towards the affected side. Then this diagram shows the difference between the supranuclear palsy and infranuclear palsy, that is the upper motor neuron lesion and the lower motor neuron lesion. Lower motor neuron, the entire face is affected on the same side, whereas in the upper motor neuron lesion, only the lower part is affected because the upper part of the face has a bilateral innervation. So that is why upper part of the face is spared in upper motor neuron lesion. Then the testing of the vestibulocochlear nerve, where it has a sensory component. The vestibulocochlear nerve has a two division, that is cochlear and vestibular division. Auditory fibers arise from the cochlea and are connected with hearing, whereas the vestibular fibers arise from the saccule, utricle, and semicircular canal and subserve equilibrium. The examination of the nerve includes testing for hearing and equilibrium. The equipments which are required are the wristwatch, tuning fork, that is 256 Hz and 512 Hz. So initially, the test for auditory function, there are two tests. One is watch test, and if there is any auditory inacuity, so then there has to be tuning fork test. Watch test. Subject is seated comfortably with the eyes closed. Each ear is tested separately by closing one ear or for loss of hearing. Then stand behind the subject and bring the watch close to the ear from distance. Ask subject when he first hears the click of the or tick of the watch and the distance from the ear is noted. So this is compared with the examiner's ears. Then the tuning fork test. When hearing loss is found in tuning fork test, then the tuning test fork are performed to know the type of deafness. By this method, it is possible to find out whether the deafness is due to the disease of auditory nerve, that is the nerve or sensory deafness, or in the middle ear or the external ear, that is the conduction deafness. The principle of tuning fork test is in conduction deafness, the bone conduction is better than air conduction, that is BC is more than AC. In sensory deafness, air conduction is better than bone conduction, that is air conduction is better than bone conduction, and in normal also the air conduction is better than bone conduction. Coming to the Rinne's test, this test compares the subject's air conduction with the bone conduction. To perform this, place the base of the vibrating tuning fork on the mastoid process of the diseased eye of the subject and instruct the subject to raise the finger when sound is no longer heard. When the subject stops hearing the sound, bring the tuning fork near auditory meatus. Again, subject is asked to raise the finger when sound is no longer heard. Confirm whether the sound has actually stopped by bringing the tuning fork close to your ear. Normally, the sound is heard longer through air than the bone because the AC is better than bone conduction. So this is called as Rinne's positive. In conduction deafness, that is obstruction to the external ear or disease of the middle ear, the bone conduction is better than air conduction. That is, this is called as Rinne's negative. The second test is Weber's or lateralizing test. This test compares the subject's bone conduction of both the ears. Place the base of vibrating tuning fork on the middle of the subject's forehead. Ask the subject whether the sound is equally heard on both the ears or better heard in one ear. Normally, sounds are heard to an equal degree in both the ears. In conduction deafness, the sounds are heard better on the affected side. That is because of the masking effect on the normal ear. In nerve deafness, the sound is better heard in the normal ear. So this is how the Rinne's test is done. After the tuning fork is vibrated, the first it is kept on the mastoid process to check for the bone conduction, then bring it near to the tragus. I mean, if he hears the sound here, then air conduction is better than bone conduction. And in Weber's, you are testing the bone conduction on both the ears. Normally the air is lateralized equally on both the sides. So these are differences between the normal sensorineural and conductive deafness. If at all there is the sensorineural or conductive hearing loss, the Rinne's test in the sensorineural deafness will be air conduction is better than bone conduction, and the Weber's tests will be lateralized to the normal ear. Whereas in conductive deafness, the Rinne's test the bone conduction will be more than air conduction, and the Weber's test, the sound will be lateralized to the affected ear because of the masking effect in the normal ear. Then Shawback's test. This test compares the subject's BC, that is bone conduction, with that of the examiner. Place the base of vibrating tuning fork on the mastoid process on the one side of the subject. Instruct the subject to raise his finger when he can no longer hear the sound. And immediately keep the tuning fork on your mastoid process and check if it has stopped vibrating, considering your bone conduction is normal. If examiner's BC is more than subject's BC, uh, that means the person is having the sensory neural deafness. Then tests for vestibular function which are not routinely done, the caloric test. Irrigate the ear, which are going to test the semicircular canals with a warm and cold water, and observe if there is a jerky movements of the eyeballs, which is called as nystagmus. Nystagmus is seen in normal person when you irrigate with a warm or cold water. In disorders of vestibular function, it results in dizziness or giddiness. So this is noted in labyrinthitis, motion sickness, Meniere's disease, and vascular insufficiency in the brain stem. So normally on caloric test, okay, so when you irrigate with a cold water, okay, so there will be nystagmus towards the opposite side, that is the fast component, and with the warm water, the nystagmus will be on the same side where the water is irrigated. The fast component is on the same side. And then the report has to be written in this manner for facial and cochlear nerve. For facial, both sensory and motor has to be written. Okay, so here only the motor has been shown. The creases on the forehead, power in the orbicularis oculi, nasolabial fold, power in the buccinator, power in the orbicularis oris, prominence of platysma. Whereas for cochlear division, acuity of hearing with a watch test, the distance should be written in the right or left. Then Rene's test, whether it is air conduction or bone conduction is better. Then in Weber's test, lateralization is mentioned. It is equally lateralized normally in both the ears. Then Shawback's test, whether it is equal to that of the examiner's bone conduction, whether it is equal to that of the examiner's, has to be mentioned. So this is in brief about the examination of the facial and vestibulocochlear nerve. Thank you.